Heart disease is a leading cause of death for men and for women. Coronary heart disease claims both genders in about equal numbers, but it's a very preventable cause of death. It helps to know what to look for, and as Lurene Cachola now explains, the symptoms for women are different than they are for men.
Heart disease kills. That's true for women as well as men. In fact, heart disease is the #1 cause of death for American women. When it comes to recognizing serious heart problems, the symptoms can be the same for both genders.
The symptoms can be the same. The classic symptoms that we think about for a heart attack, for instance, the crushing chest pain, the elephant sitting on your chest, that's what we typically think of. And certainly those can be present in men or women.
Doctors Jennifer Morrow and Stacy Smith of the Stern Cardiovascular Foundation say while many symptoms are similar for both genders, there are differences.
There was a study that came out in November in the Journal of the American Medical Association that looked into this. And it's really important that we distinguish the difference between people who are presenting with a heart attack and women who are having signs and symptoms of developing heart disease.
Heart attacks in women can be silent, without the chest pain that shows up in men.
We look a little bit more about the symptoms that may be less common or more subtle. Things like jaw pain, things like shortness of breath or fatigue, which may not classically be associated, or what someone may not classically think of as a symptom of a heart attack.
And women should be aware that there are ways to tell when a symptom of heart disease is more than just a general feeling.
A sudden onset of a symptom. So again, if you're able to climb a flight of stairs either at home or at work, and you've been doing that without any difficulty, and all of a sudden, halfway up a flight of stairs, you're profoundly fatigued or you're very short of breath, that is something to be concerned about.
According to the National Heart, Lung, and Blood Institute, not only can the symptoms of coronary heart disease be different between women and men, sometimes women won't have obvious signs.
We have to do other tests. We need to do an electrocardiogram and some blood tests. We need to ask about exactly what Dr. Morrow said. Shortness of breath, jaw pain, arm pain, fatigue. Those are things that would suggest that this has been building up and is now a heart attack. We need to look deeper.
Both men and women share traditional risk factors for heart disease: high blood pressure, high cholesterol, and obesity. But mental stress and depression, smoking, low levels of estrogen after menopause, and metabolic syndrome, a combination of abdomen fat, high blood pressure, high blood sugar, and high triglycerides, can play bigger roles in the development of heart disease in women. That's why women should raise the topic of heart disease when seeing their doctors.
Dr. Morrow and I both see a lot of patients for exactly that reason, people who are concerned about their risks, they don't have any symptoms, and that's probably one of the most exciting things that we do is try to help them prevent the development of disease by all of the things that she and I just discussed can allow a woman to empower herself to be informed and make these changes in her life.
Prevention can include exercise, maintaining a healthy weight, quitting smoking, and cutting fat, cholesterol, and salt from the diet. For Smart Medicine, I'm Lurene Cachola.